Hello, my name is Sam Allen. I'm the Chief Executive of the North East and North Cumbria Integrated Care Board, and I'm also the Chair of the Health and Care Women Leaders Network, which is delivered by the NHS Confederation. First of all, I want to say a huge thank you to your Women's Network Chair, who has asked me to just say a few words at your conference. I'm really sorry that I can't be with you in person. One of the things when you take on kind of a national leadership role, and what keeps me very grounded, is my priorities are here absolutely in my community in the North East, North Cumbria, and I've just got a work commitment that I can't get out of. It's also a week after International Women's Day, the 8th of March, and I really hope that you all took that day to celebrate and also really embrace the theme of International Women's Day, which was embrace equity. And I kind of really wanted to start there really, because equity, equality, similar words, all derived from the same word in the dictionary. And sometimes we think about fairness, we think about equality, it's about being equal. I guess one of the things that certainly I've come to appreciate so much more, particularly through the Women's Network, is the difference that we have as a group of women, and whether that's in terms of age, race, sexual orientation. There are many different characteristics that each of us hold, and of course we're all unique, but we're different. And I think when we think about equality, we hear a lot about equal opportunities, and certainly in recruitment practices that's used quite a lot. But where we really wanted to kind of push the equity use of the word equity is recognising actually everybody starts in different positions, you know, and here in the North East and North Cumbria, 2 in 5 of our children live in poverty. So their starting life is quite different to a child who isn't living in poverty. And we could layer on lots of other examples. Another one would be in maternity services. Sadly, it's a fact that if you're a black woman, you're 4 times more likely to die in childbirth than white women. That's a fact. It's hard to hear, but it is a fact. And of course, you'll know that through integrated care systems, all organisations working together, mental health, learning disabilities, autism, with the hospitals, with the community and voluntary sector, with social care, actually we've all got a role now around improving population health. And if we looked at every member of our population as equal and all starting in the same point, we just keep doing the same things for everybody. And then we wonder why we get different results. And I think during COVID, that was one of the things we really learnt, actually, and hard lessons, very hard lessons. We know researchers already telling us that the women's experience of COVID was in most circumstances different to a man's experience. And part of that is because the caring responsibilities, and that's not to say that men don't, but actually the evidence shows that women still do pick up the majority of the caring responsibilities, both in and outside of work. And we also know that sadly COVID as a virus had a differential impact depending on some of your characteristics. So this whole notion of embracing equity, the theme from International Women's Day several days ago, is that actually we need to be thinking differently about diversity, about inclusion, and really understanding actually where those differences are, and how, if we're thinking about advancing women in the workplace, perhaps we need to do some things differently. And there are some fabulous examples where women are leading that change. Sponsorship is a really good example of that. Actually, mentoring and coaching will only get you so far, but actually sometimes it's about having the door opened, you know, open for you, that lift on the ladder. So through the Women's Network, we talk about lift as you climb. One of the other things that I do, I'm a trustee with the Chartered Management Institute, and as a manager in the health service, I'm really passionate about professionalising management standards. I think sometimes when we look in the NHS, and I've now worked in the health service for over 25 years, I kind of think that management skills are something that sometimes are kind of just assumed that go with an increase in a banding, increased responsibility. Yeah, actually, we know, and we know through staff survey results where we still get, unfortunately, high levels of bullying. There's a very high percentage of people that leave the NHS in their first 2 years because we're not always, through our people practices, creating environments that are psychologically safe for people, that recognise inclusion, and we're not always equipping our managers with the skills to do the job. So I'm really keen that we see the report, the Messenger report, the review into leadership, which has got a recommendation around management standards, really be implemented and consistently implemented. I always say to people, people don't usually leave their organisation, they usually leave their line manager. That relationship is so crucial. So I do think that as managers we can make a huge difference for people in their working lives, and making sure that they're working in environments that are nurturing, that are kind and that are inclusive. So women make up nearly 80% of the NHS, 82% of social care. So actually as a group of women, as a group of diverse women, we have a huge opportunity not only to shape the lives of our patients, our communities that we serve, but also to lift and support each other. There's nothing worse than a woman not supporting another woman. And yet I can imagine that a lot of us have had personal experience where that's been the case. So look, I think it's fabulous that you are having a women's conference. I think it's wonderful that you have a network in your organisation, and through our network of women's networks, we've now got nearly 50 right across England. We want to be the change we want to see, you know, to lean in, to be part of the solution, to not just be a commentator on things that are wrong, or we've got ideas but we don't yet have the kind of agency where we can get on and implement those. So I say, you know, rise up, you know, through your network, really mobilise to really look at making those changes in your workplace that you can see that's possible, and work with your leaders to do that. And I know that you will already be doing that in abundance, but, you know, we need to do more. In your community of your network, you will have huge strengths and diversity. Celebrate them, share them. And I suppose my one sort of final message is, don't let perfection be the enemy of success. If you're thinking about going for a new job, don't let the one thing in the job description put you off. The one thing that you feel you can't do put you off, you know. Go for it, and you'd be amazed at what you can achieve. So have a great day, and please do, if you're not a member of the Health and Care Women Leaders Network, if you just Google it, we're on the NHS Confederation website, it's free to join. We've got a monthly newsletter that goes out, lots of opportunities to get involved in national conferences, seminars. We're all about sharing good practice. We're doing lots on menopause, safe places to work and flexible working. So please get involved, but, you know, let's be the change we want to see. You know, women are leading the NHS. We make up that nearly 80% of the workforce. We have got the power to be the change we want to see. So seize it, grab it, and don't let anybody stop you. Thank you.